Hi, my name's Johnny Blackwell. I'm a gastroenterology research fellow at St George's, and I'm going to be talking about our research looking at smoking and ulcerative colitis. So, ulcerative colitis is a form of inflammatory bowel disease, which typically presents with bloody diarrhea. And if it doesn't respond to medical therapy, then patients may require a colectomy to remove the bowel. The story between smoking and ulcerative colitis begins in Cardiff back in 1982. The gastroenterology team there noticed that only 8% of their patients with UC were smokers, compared to a massive 44% of controls. And since then, there have been lots of studies which show smoking reduces the risk of developing UC. That begs the question, should patients with UC smoke? What do patients believe? Actually, 39% believe smoking has a protective effect in UC. And 1 in 5 ex-smokers with UC reported restarting smoking to prevent flares. Let's look at the evidence. This meta-analysis of 4 studies suggests there is no benefit from smoking in colitis. It found smokers were just as likely to have a flare of their colitis as non-smokers. When looking at smoking and the risk of colectomy in UC, this meta-analysis didn't find smoking reduced the risk of having an operation at all. So that's really nice and clear, I think. There's no benefit from smoking in UC, except another meta-analysis with different inclusion criteria found smoking does reduce the risk of colectomy, and in this study, it suggested it reduces it by quite a lot with an odds ratio of 0.55. So what do I tell my patients? Well, in Chicago, they've been advising ex-smokers to take up smoking again. And in this study, 14 out of 15 patients they advised to do that got better. And I think clearly you're probably getting an idea that there's a bit of a knowledge gap here on this subject, which led on to our study. Our study aimed to assess the impact of smoking in UC, particularly looking at the risk of steroid use and flares, steroid dependency, thiopurine use, surgery, and we also wanted to explore the impact of smoking cessation in UC. We used a primary care research database called CPRD, which is nationally representative of the UK population, to identify all patients diagnosed with UC between 2005 and 2014, and we examined their smoking status and disease outcomes. Overall, we identified over 4,000 patients, the majority of whom were ex or never smokers, and 13% were current smokers. And this is what we found. Smoking status made no difference to the risk of first corticosteroid use, nor did smoking status change the risk of colectomy. What about patients with UC who then quit smoking? How do they fare? We identified 334 smokers at diagnosis, with further data on smoking in the 2 years after diagnosis. And of those, 37% quit and 62% carried on smoking and were persistent smokers. And we found that quitters did no worse than persistent smokers with respect to steroid use and dependency, the number of flares they had per year, nor did it make any difference to rates of escalation to a thiopurine to control their UC, though it may be the case our study was underpowered to look at that last outcome. We also looked at the impact of smoking intensity and grouped patients as never smokers, light smokers who are having less than 10 cigarettes a day, moderate smokers who had 10 to 19, and heavy smokers who were smoking more than 20 cigarettes a day. And you can see from this graph that the more cigarettes someone smoked per day, the less likely it seemed they were to become dependent on corticosteroids for their UC. We then compared the risk of steroid dependency between heavy smokers and never smokers in a multiple Cox regression, and the difference between those two groups didn't meet statistical significance, but that's probably because this analysis was underpowered with only 136 heavy smokers in our group. So in summary, we conducted the largest study to date on this subject, including more than 4,000 patients with UC, and found smoking doesn't reduce the risk of steroid use, steroid dependency, flares, thiopurine use, colectomy, or hospitalisation. And importantly, we established that smoking cessation in UC is safe. So in conclusion, smoking is not recommended in UC, and smokers should be encouraged to quit. I'd just like to thank all my co-authors, in particular my supervisor, Professor Pollock, and I'd like to thank you very much for listening. Thank you. Bye-bye.